one of my mentors, his name was John Tevitz, he just passed recently, and he taught me rhinoplasty and breast augmentation. And right into my career, he was my main cheerleader, my main mentor, and really taught me breast augmentation. And everything I do is kind of his kind of ideas, or my minimal modifications of those concepts and ideas. And I think the one of the most important things that he taught is you can have very minimal complications and you can get patients to recover very quickly. So the vast majority of our patients will recover within 24 to 48 hours. And most surgeons and most patients don't believe that. And so, occasionally we'll get particularly younger patients that have a little bit more of an emotional component, to their pain. You probably know who you are. Those patients are going to take a little bit longer to recover, but particularly postpartum patients who've had babies, they've had the reset on their pain threshold a little bit, but their breast has been stretched a little bit. Most of those patients will recover really fast, like 24 to 48 hours. And so it's really due to starting the fast track recovery in surgery. So it really involves the bloodless approach, so you're not traumatizing the ribs and creating bleeding and which creates bruising and more pain and more swelling. So it's basically not one drop of blood. It's blocking the breast, so you get a great numbing of the breast. So it's really more of a pressure feeling. I've not felt this personally, but every patient, almost to the person, says it's kind of like my milk came in. I'm breastfeeding, my milk came in. That kind of general pressure, that's what you should expect. We have patients start moving their arms above their head right in recovery. So the fast track really involves active motion. So we really want you moving your arms above your head, kind of stretching your chest and really moving. You can lift immediately, babies, jugs of milk, those sorts of things immediately. We want you to really just have the mindset, okay, if I feel good enough, I could go out to dinner tonight. And so the vast majority of patients can do that and get to that point without narcotics, and it is real. And I have patients all the time come in and say, my friend had a breast aug. She was in bed for 2 weeks. She took 6 weeks to recover. She had all this bruising, swelling, glistening of her breasts, all that. I could totally relate to that. Early in my career, we used to do transaxillary augmentations with saline implants through the armpit, and there's no control of the bleeding, so patients are very sore, a lot of swelling, a lot of pain, so I certainly understand that. The vast majority of patients will easily recover within 24 to 48 hours with that gentle sort of pressure, sometimes more, pressure on the chest. And you can get back to work long weekend. Some of the other recovery things we do, as far as within a week, you can do non-impact things. So elliptical, stationary bike, walking for exercise, those things. You can do lower body workouts, those things. About a month before you can get back to complete full impact chest exercises, those sorts of things. But that's kind of the routine, normal return to activity that our patients can achieve.